ya que ser sociales, sino extrasociales, lo he dicho antes, porque creo que las consecuencias, tanto desde el punto de vista del estado del bienestar, de la protección de aquellos que puedan verse damnificados como consecuencia de la enfermedad y las decisiones y el impacto económico que va a tener esas decisiones en las administraciones públicas, necesitan de un apoyo extra presupuestario que ahora mismo no está reconocido en los actuales presupuestos ya prorrogados. Y además porque tenemos que poner en marcha medidas de estímulo fiscal para permitir que sectores determinados pues, puedan volver a retomar su actividad económica, la que tenían antes del conocimiento de esta pandemia.
Dos últimos turnos de pregunta, presidente. María Rodríguez, de Televisión Española. Se plantea al Gobierno, insiste en las medidas restrictivas, poner en marcha más medidas restrictivas en línea de Italia. ¿Hay previstas medidas en el tráfico aéreo? Y última, ¿cree el Gobierno ahora que fue contraproducente la manifestación del 8M?
Insisto, siempre hemos tomado las medidas en función de lo que nos ha dicho la ciencia, los expertos. He dicho también que estamos hablando de una crisis que no es estática, que es absolutamente dinámica, que evoluciona, no iba a decir ya diariamente, sino también cada hora, y en consecuencia el Gobierno de España lo que está haciendo es adaptarse precisamente a esas recomendaciones en función de la evolución horaria de la crisis. Y, desde luego, nosotros no tenemos más que añadir que ese seguimiento, esa voluntad de seguir las recomendaciones que nos haga la ciencia.
La última pregunta, de Mercedes Serrayer, de Expansión. ¿Cuándo prevén aprobar medidas de agilización de ERTE y la prestación por cuidado de hijos? ¿Y mantiene las subidas de impuestos ya pactadas y las nuevas que ha anunciado, impuestos de billetes de avión, envases de plástico, etcétera, y las medidas de contrarreforma laboral?
Bueno, vamos a ver. Lo primero, ¿necesitamos unos presupuestos? Sí. ¿Unos nuevos presupuestos? Sin duda alguna. Y eso es lo que le voy a pedir a los grupos parlamentarios en las próximas semanas. En segundo lugar, nosotros estamos trabajando intensamente, llevamos horas trabajando en ello, para que demos una respuesta social, sobre todo a aquellos colectivos más damnificados como consecuencia del parón de la actividad económica. Y, por tanto, en las próximas semanas, en los próximos días, pues lógicamente seguiremos aprobando nuevos paquetes de estímulo fiscal, de estímulo económico, para amortiguar, en la medida de nuestras posibilidades, pues los efectos tan nocivos que está teniendo esta crisis sobre el tejido productivo de nuestro país.
Gracias, presidente. Gracias a todos los participantes. Buenas tardes.
Muchas gracias.
rentabilidad del bono se desploma tras la bajada urgente de intereses en 50 puntos básicos y la expansión de su balance general. Aquí vemos cómo el año pasado trataron de desmontar la estafa Ponzi. Ahora están volviendo a expandir el balance general. Lo que pasa es que los inversores en el mercado de deuda nunca llegaron a tomarse en serio ese intento, como demuestra el hecho de que la rentabilidad del bono a 10 años no dejara de caer.
Los bancos centrales, que son el cáncer de la sociedad, están viéndose obligados a llevárselo todo al interior de la ciudadela. Lo que pasa es que aún no podemos cantar victoria sobre ellos porque tienen la capacidad de expandirla exponencialmente. Y por cierto, el coronavirus afecta especialmente a los miembros de la generación del baby boom, a la gente de 60, 70 y 80 años, lo cual puede dar algo de esperanza a los jóvenes. Además, la generación del baby boom es precisamente la que más reticente se muestra al Bitcoin. Así que ambas pandemias, la del Bitcoin y la del coronavirus, se están cebando con esas personas. Por eso digo que ahí tenemos la prueba de que la madre naturaleza está tratando de cederle el testigo a una generación más joven e ilustrada.
Por cierto, cabe añadir que la empresa de Nassim Taleb, que se dedica a analizar el riesgo sistémico, recomienda a la gente de 50 años que no salga a la calle.
Cosas de la madre naturaleza. Y Nassim ya tiene 60 años. En fin, les esperamos a la vuelta de la pausa con mucho más. No se vayan.
Vamos a ver qué hay aquí. ¡Ay, Vamos a conocernos con una chica. Qué guapa.
Tengo que confesar que sí estoy un poco nervioso porque exactamente no sé qué va a suceder.
Es curioso. ¿Un bosque? No es tan fácil como parece.
Dios, no puede ser. Se me acabó el camino. Ajá.
¡Entramos!
Estoy encantada con esta máquina. Como dijo Gagarin.
¡Vámonos!
Bienvenidos de nuevo a Kaiser Report, soy Max Kaiser. Es hora de hablar con Steve King, autor de La economía desenmascarada. También pueden encontrarle en su página de Patreon, Prof. Steve King, que les permitirá convertirse en sus alumnos por mucho menos de lo que les costaría apuntarse a la universidad. Ya sabemos que las universidades no valen para nada. Bienvenido de nuevo, Steve.
Es un placer, Max. Me gusta el programa, aunque no el tema de hoy.
Muy bien, vamos a hablar del coronavirus. Usted ha escrito hace poco que hay que empezar a pensar de manera exponencial para contenerlo. Explíquenos en qué consiste eso de pensar de manera exponencial, Steve.
Pues a ver, se trata de una vieja analogía, Max. O bueno, más bien de dos. La primera es la siguiente. Imagínese un lirio que crece en un estanque y que cada día se
what that means to this state's revenues. You cannot calculate it, and then you'd have to, well, guess, when is the market going to come back? When does coronavirus clear? When do the hotel rooms relist? You know, so you don't know. I can tell you this. It is going to, I don't see any possibility of states being able to handle this on their budget without federal action. What is our unemployment insurance cost? What is that going to go to? You know, who knows?
Yeah, I just wanted to follow up on the ban of over 500. How often are you going to evaluate that? It's like, you know, you didn't say it was going to be for 2 weeks or anything.
Daily.
Daily?
We'll see. We'll watch, look, we watch this 24 hours a day, right? As the numbers change, I can't tell you anything more than the numbers tell me. I see those numbers going up on the number of cases, on the hospitalization rate. I see that going up. I adjust to the numbers. Commissioner of Health adjusts to the numbers. You tell me when those numbers turn, or when we turn those numbers. Remember, China, South Korea turned the numbers. It wasn't that they waited for the virus to exhaust itself and burn itself out. They turned the numbers. You tell me when we turn the numbers, your guess is as good as mine, but we will calibrate it to whatever it is. I'm looking at that hospitalization rate. We want to make sure that we can handle that hospitalization rate, whatever happens to the denominator. I believe, and I've said from day one, these tests were very deceptive because we never had the testing capacity to have a valid sample. And to say, well, there's only 300 cases in the state of New York. No, that's not what it's saying. If it was 10 times that, I would not be surprised. So I'm looking at the hospitalization rate.
So what happens to the state capitol during the occupancy reduction? You have 213 legislators plus their staff on a legislative session day. You can easily get to more than 500 people in this building.
Yeah, I think we're probably at 50% occupancy. We exempted government buildings.
What are you going to do with the Capitol? No, I was going to say, what are you going to do with the Capitol? I mean, it's obviously a large gathering place, regardless of the numbers. Are you concerned about people coming in and out of this building as you get into the budget?
We're considering what the Congress did, which is banning visitors. That's something we're looking at, but we haven't made any decision.
Well, the occupancy of the 0 to 500 reduced by 50%. Will that cover houses of worship as well?
Yes.
And then just to follow up on that, you know, sporting events are being canceled, parades are being canceled, people are...
Postponed. St. Patrick's Day was postponed. Hogan is sitting right next to you. She'll hit you with her laptop.
And they're buying food, they're buying toilet paper. What's your message to New Yorkers about how things are seeming to change very rapidly right now? What do you say to people who see that things are changing?
Nick, the perception is changing. The reality hasn't changed. I mean, we have been talking, I've said the same thing to you every day for the past 3 weeks, I think. You're going to see these numbers go up. You had to. You saw last November, you saw China, and you saw the numbers increasing in China in November and December. You know what this virus does. You knew someone was going to get on a plane in China and come here. That was not a leap. So you know the spread, you know the numbers, you know what they had to do to change the trajectory of those numbers. You know the close downs that they had to do, the measures they had to take. You know how many tests they were taking. What makes you think that the virus in China or the virus in South Korea or the virus in Italy was going to react any differently than the virus here? This was always going to happen. And that's why I said, you're looking at these testing numbers. The testing numbers mean nothing. You are going to see the same trajectory that you saw in China and South Korea and Italy, and it is going to happen here as the virus spreads because of the way it actually is contagious. And the only question is, are you gearing up to handle that? Are you doing enough testing so you're isolating the positives and slowing down the spread? Are you doing the density reduction to reduce the spread? And then can you handle the hospitalization number that's going to result from that infection rate.
How long are the density rules in effect?
For the foreseeable futures until it changes, Jesse.
There's no end date at this point?
There's no end date. It will be calibrated to the spread of the virus and the treatment of the virus. Obviously, we all want to get back to work as soon as possible. So as soon as we can go back to normal, we'll go back to normal. But we are still ascending, right? We are still on the upward trajectory of this disease. No one that I know, I speak to national health experts all day long, more importantly, Commissioner Zucker talks to them all day long. I don't think anyone has said, you have seen that line start to turn. All you see is that line still going up. So this is going to get much worse before it gets better. That was always the fact. That was always the necessary numerical conclusion to this. When I kept saying it's math, look at the spread, it's math. It has to get worse.
We're finite amount of testing capacity at the moment. At what point should people go to the ER or to their primary care physician to seek assistance or help, so not to overwhelm?
So they should call. I've had personally people call me who have asked me that exact question, and I've said you should call ahead to your doctor, discuss your symptoms with them, and let them guide you in the right direction. And then if you go to the emergency room, your doctor should call ahead to let them know that you're headed there.
But should they be monitoring themselves if they have a fever for more than a certain number of days, or if they have respiratory issues?
I think that's a clinical judgment because every patient's a little bit different. Some people may have underlying medical conditions, and you should adjust it accordingly.
On the 500 rule, who's enforcing this, and what are the penalties if it's broken?
Please.
So there's going to be a range of penalties. It can be fines, or it can just be getting shut down. So businesses who aren't adhering to it could be shut down. That's the most dramatic point, obviously, and we don't anticipate people are going to do that. Actually, all the businesses we've been communicating with were eager for clear guidance on how to operate in a safe, healthy way, or you can be served fines. And we're going to work with the locals to the enforcement on the local level.
Does this affect large office buildings? You're talking about venues with 500 plus.
We have not had, and this is sort of remarkable, and it's a beautiful thing to say about New Yorkers, we have not had a legal situation on any of these things that we've done, right? There's never been, in all these measures, quarantine, all these things we've done, no one has ever said, I refuse, I resist, and brought it to a head. And I don't believe it. We've done this in consultation with all the businesses because, look, everybody has the same interest here. Everybody wants to make sure we get through this and we get through this as easily as possible. Go ahead, I'm sorry.
Governor, the measures that you're taking to increase hospitalization rate, how many beds have you increased, or what is the goal for this?
Well, that's what we're watching, right? That's what we're watching. What's going to happen, right? Well, these are the numbers we look at, right? You watch the number of cases that are going up, and then you watch the hospitalization rate, and that's what you want to be prepared for. How high is that number going, how quickly, and what is the hospitalization rate on that number? And then when we say what's going to happen, what's the bottom line, this is what's going to happen. This is what was always going to happen. Those numbers are the numbers from China, South Korea, Italy. That's what's going to happen. Those proportions will happen here.
So what's the proportion here?
Whatever the hospitalization rate was and the growth rate. You don't know the denominator because you don't know how good you are at stopping the spread. How quickly do we come up to speed on testing? How successful are we on density reduction?
Well, I'm not asking you to predict what it's going to be. I'm asking what's your capacity increase to under all these measures?
Well, the elective surgery alone, depends on the hospital, is 25 to 35% of additional capacity. In other words, 25 to 35% of the hospital beds are now elective surgery. Is that the term, elective surgery? Because I don't really have my full degree yet. 25 to 35% are elective surgery. Just stopping elective surgery adds 25 to 35%. So you then have the facility question. I think one of the outliers here and what happened in Italy is the staffing more than it is the facilities. Healthcare workers get sick. And what is the backup for sick healthcare workers? And that's why we're taking these extraordinary measures, past nurses, past doctors, National Guard, medical personnel from a medical school. So you have the facility capacity, staffing capacity. I frankly think the staffing capacity, if anything, is going to be more of a problem than the facility capacity.
What is that, 25 to 30?
Electives. You want to do that, Don?
So elective surgery can either be outpatient or inpatient surgery, right? So it's a reflection of the entire healthcare system. You would have, if you don't do elective surgeries, the physicians, the nurses, everyone's involved would be able to redirect their energies towards the patients who would be in with coronavirus.
How many beds are we talking about? How much capacity is increased?
Well, I have to look at it, give you an exact number, but it is a significant, I can't give you exact percentage, but it's a significant percentage.
Business loans, have you made any more progress on business loans for businesses are not only losing business, but also employees?
That's going to have to be done on a federal level. This state is not going to be able to compensate businesses for lost revenue. It would bankrupt the state.
Does quarantine apply to large office buildings? Does it, you mentioned Broadway, obviously, does it apply to?
It's congregate spaces. So large office buildings, you don't have 500 people in one room, right? People are in their own individual offices. This is about, remember, it's about social distancing. It's about staying 6 feet away from people. It's not putting people in where you're massively packed into a space. So unless you have an office space where it's an open bullpen with 500-person occupancy, it doesn't apply to you.
Broadway League says it's going to reopen
It's concentration, it's density, it's proximity.
The Broadway League says it's going to reopen on April 13th. Is that accurate to what you understand?
They're closed until we've
We'll see.
reopened.
How many cases are currently online?
Wait, I'm sorry, go ahead.
Thank you. So the known cases, should we be quarantining them at home with their families or separating them and putting them in separate facilities?
Just restate the question.
The known cases that we have confirmed cases, should we be quarantining them at home with their families or separating them?
So they are, if somebody is at home who is positive, then their relatives who are negative are away from those individuals who are positive, separated.
Who didn't ask a question yet? You're behind the camera, you don't get to ask a question. All right, that's the rule. The rule is if you're behind the camera, you can't ask a question. Okay, go ahead.
When you talk to the speaker,
So much for the rules, right?
When you talk to the speaker and the majority leader, is there any discussion on delaying the budget?
Nope. Now, the budget. The budget director, the budget had a revenue, the budget's premised on a revenue projection, right? What's the first number in the budget? It's the revenue projection. The revenue projection was based on a reality 60 days ago that no longer exists. That's why I asked the controller for his opinion. And by the way, I asked the controller for his opinion on a revenue estimate last week. Since then, reality has changed 11 times. You look at that stock market, you tell me what the revenues are going to be. So we have to do a budget. You have to now come up with an estimate on revenue projection. Your expenses have also changed dramatically. You tell me what our unemployment insurance cost is going to be. We did an unemployment insurance cost estimate before any of this. How many people are going to be unemployed when these businesses and the supply chain, how many people are going to be unemployed when their business says, don't come in, we're not operating? So it makes the budget process much more difficult. Because in truth, nobody can tell you. Nobody can tell you what that revenue projection is going to be. Nobody can tell you what the costs